Welcome everyone. In this video we're discussing the anatomy of the femoral artery, specifically a right lower extremity image here, which has all of the branches of the lower extremity circulation, at least the upper thigh, and this is probably one of the most important anatomies to be familiar with, and the reason for that is the femoral artery has traditionally been the artery used for a lot of procedures such as angiography, whether it's cardiac catheterization or mesenteric or even arterial lines. So a lot of things are done through the femoral arteries, and also the femoral arteries can be prone to injuries. The same way the different branches can also be prone to injuries or spontaneous hematoma. So what I wanted to use as an example was a recent case I had in which a patient that was on Coumadin, and pretty much this can happen with any blood thinner, not just Coumadin. So patients that are on Coumadin or other blood thinners can have spontaneous hemorrhage or spontaneous hematomas. They can be a retroperitoneal hematoma. They can be an abdominal wall hematoma. In this case, I had a patient that had an abdominal wall hematoma. Most of the time when you have abdominal wall hematomas, they're related to a branch of the inferior epigastric. So I wanted to identify the inferior epigastric here for you guys, but also I wanted to mention, so think about what procedures can cause an inferior epigastric injury. And a common one is a paracentesis, in which is what people call an abdominal tap. Patient with ascites, which is a collection of fluid in the abdomen. Sometimes they get a paracentesis to either diagnose what's happening with the ascites, or to do a therapeutic paracentesis in which you're trying to decompress the abdomen just for patient relief and so on. So the inferior epigastric in this case is shown by number 15, and we're stepping out of order, then we'll go back to order. But so number 15 here, you can see it's arising from the common femoral artery, which is number 14. And actually I should correct myself. So this small portion here is the external iliac. We have the inguinal ligament that distinguishes that one from the common femoral artery. So technically this one's the common femoral artery, and then you can have the inferior epigastric arising here or even a little bit lower, and it's going to have this medial turn and it goes up into the abdominal wall. Then it has multiple branches that we're not seeing here, and some of those branches can be injured. So one of the first treatments to do from an interventional radiology standpoint, or an endovascular minimally invasive approach, is to go in typically from the contralateral groin, and you engage this artery here, and you're able to perform a diagnostic angiogram, confirm that this is an artery that's bleeding, and you can treat with different agents such as particles or gel foam, and that treatment should help this bleeding stop, and that treatment would be called an inferior epigastric embolization. Sometimes we do see the bleeding during the angiogram. Sometimes the bleeding has subsided, but we still treat in order to achieve control. Sometimes one of the reasons we treat is that the patient will need to resume anticoagulation at some point, and by having some plug there, we minimize the risk of this patient having an additional bleed. The other one, so let's go back to number 1 and start in order. So number 1 is the circumflex, but specifically the dip circumflex branch, or the dip circumflex iliac artery. And the reason I wanted to mention this one, so this one is, people tend to identify it a lot on angiograms, but I had a patient that had a spontaneous hematoma, and in this case it was not arising from the inferior epigastric, which is probably more common. This one was arising from a branch from the deep circumflex artery. So today I was able to do that treatment, and we treated a patient for a deep so we embolized a dip circumflex iliac artery, and we were able to achieve control. Moving on to number 2, you have the superficial circumflex artery, which is also another artery that we should have in mind. Sometimes when people do access for an angiogram, this superficial circumflex artery can be injured. Number 3 here, a little bit below. So now we start getting into additional branches. This is so-called the lateral femoral circumflex, but it is a little bit more descriptive, and then anatomy here can be a little bit more variable. Then number 4 is the transverse branch of the lateral femoral circumflex artery. Then number 5 here, we have the lateral femoral circumflex artery. So you can see a pattern here, okay? All of these are circumflex arteries, and they have different names that are really just being descriptive. Finally, number 6 is a descending branch of the lateral circumflex artery. And with those, we pretty much have covered a lot of the circumflex arteries. So the pattern here is all these circumflex arteries are going to be arising from the lateral aspect of the lower extremity or the femoral artery, and like I said, this portion here is technically external iliac artery. So you get the point. It's the lateral aspect, nevertheless. And later on, we have some more basic anatomy. So we have the typical branching, in which you have the superficial femoral artery here, and then we have the deep femoral arteries, and we have different penetrating branches of the deep femoral artery. And the bifurcation is illustrated here. This will be a very classic bifurcation, but sometimes this bifurcation can go very high, and that's also an important consideration for us when we're doing procedures. So really have in mind that this is a typical diagram, but things might change a little bit. It's just important for you to have a map of the distribution, but there can be some significant variation from patient to patient. So this bifurcation that we're seeing here can be a little bit higher in some cases. So I think with that, we've covered pretty much most of the challenging anatomy in this region. Everything else we have is the more traditional. So we said, the superficial femoral artery, sometimes referred to as a SFA, and then finally, we have around the knee, we have the genicular arteries, and that's another common pathway that's described, and we'll probably talk about that in a later time. I think most of the time the relevant anatomy for spontaneous bleed is going to be related to the ones I mentioned. Sometimes we can have pseudoaneurysms that arise here when a patient had a procedure, but there's not enough closure of that artery, or there's a small injury, a small hematoma that accumulates. You can have a pseudoaneurysm, which is an outpouching of this artery, and we have several treatment options for pseudoaneurysm, but I just wanted to mention a common one is thrombin injection under ultrasound guidance of a pseudoaneurysm. And by injecting a very small amount of thrombin, we're able to create a blood clot in order to occlude that pseudoaneurysm. So the typical dilution is 1,000 units of thrombin in 1 cc, and you often don't even need 1 cc of thrombin. The important thing is to be careful. I mean, here we're not illustrating the aneurysm, but you want to have some neck. You want to be careful not to inject thrombin into the artery. And that's always, at the very least, there's a theoretical risk that some thrombin can go into the artery. And the expectation is that even if you get a tiny amount of thrombin into the artery, because this femoral artery is going to be a lot higher flow than a pseudoaneurysm, which is the outpouching that you get the classic yin-yang sign on ultrasound, and so blood coming in and coming out. So within the pseudoaneurysm, you're more prone, which is what we want, to cause thrombosis. While if you have some thrombin in the femoral artery, at least in theory, it should wash out and it's less prone to forming thrombus. So that's also another, aside from having a long neck and being very careful on what you inject, the other safety mechanism is that the femoral artery is going to have a lot higher flow and maybe be protective even if some thrombin goes into that system. So that's it for this video. Don't forget to subscribe and share, and feel free to ask any questions that you might have.